Hi, I'm Dr. Morris, and this video is a consent video related to the extraction of wisdom teeth. We're going to talk about the risks, benefits, alternatives, and consequences to having your wisdom teeth removed. Most commonly, wisdom teeth are removed to improve the health of the gums, if there's not enough space for impacted teeth to grow into place, to relieve pain, those type of symptoms. For any tooth extraction, we expect pain and swelling to be a part of the healing process for the first 4 to 5 days. You'll be given prescription pain medicines to help you through that healing time. And some bleeding is expected for 1 hour up to 24 hours afterwards. Today you'll go home with a care package that includes extra gauze to bite on, an ice pack to limit swelling if you get swelling, some protein powder that will help with your nutrition, an essential oil to aid healing, and an information sheet that includes my cell phone number so that you can contact me if you are having any problems or questions. The other things we'll talk about are unexpected consequences of the healing process, but you should be informed about them in case it happens to you. The most common problem we see is a dry socket, and what that means is once the tooth is extracted, the socket should fill in with a blood clot. If there's no blood clot there, that's a dry socket. The problem with that is that it's more painful than usual during the healing process. You may feel like the pain medicine doesn't work, or the pain is not getting better after 4 or 5 days, or even getting worse after the first 2 days. If you think you're getting a dry socket, please call me for follow-up. What we will do to try to avoid a dry socket is draw some of your own blood after you're sedated, spin that blood in a centrifuge to separate out the white blood cells. We'll put those white blood cells back into the socket. This will help you heal faster, it will help develop a better blood clot, and lower your risk of a dry socket. What I want you to do is, the first 3 days that this is healing, don't do anything that's going to change the pressure in your mouth. That means don't suck on a straw, no smoking, don't use a mouthwash. Anything like that could cause the blood clot to come out. You might do everything right and still get a dry socket, so contact me if that's happened. If you were to get an infection, the main sign of that is swelling that's getting worse after day 2. The first couple of days we expect swelling as part of the healing process, but if it gets worse after the second day, then please call me. I don't prescribe an antibiotic for every patient unless you think you're getting an infection. A nerve injury is a risk to the lower wisdom teeth. When the lower wisdom teeth are removed, if the nerve is injured, it can cause the lip on that side to feel numb. It doesn't affect the movement with talking or eating, anything like that. It's just the sensation of that lip. If the nerve is injured, sometimes it can heal slowly and come back to normal in 6 months to a year. In some cases, that injury is permanent. We'll look at your x-ray to tell you your specific risk related to that. A broken jaw is also a risk. When a tooth is extracted, that socket is a weak spot in the bone, and it can take up to 6 months for the bone to fill in and strengthen that area of the jaw again. Please be careful of any impact to the chin, for example with karate or contact sports, during the first few months after your wisdom teeth extraction. An opening to the sinus is a possibility with upper wisdom teeth if they are impacted. We'll look at your x-ray to tell you your risk on that. If you have any TMJ problems with the joint or tight muscles, please let us know. We try to protect any strain to the jaw by using a rubber bite block during the procedure. Damage to the adjacent teeth is possible, especially if you have decay, large fillings, or crowns on the teeth next to this wisdom tooth. Some patients experience tight jaw muscles the first few days after tooth extraction. If you feel like you have limited opening, then massage and stretch by pulling on the lower teeth are the best to loosen up those muscles. Death is a risk related to sedation and wisdom teeth extraction. We take precautions not to oversedate our patients. We sedate slowly. We'll give you time to wake up at the end before we send you home. If you have any question about that, please talk to us before we begin the procedure. The sedation will cause you to feel drowsy for 3 hours. The first hour you'll be getting your procedure done, then you'll feel like you want to go home and nap for 2 hours after the procedure. I do recommend that you limit your activity for 24 hours. That means don't drive anywhere, don't use any power tools, anything where safety is an issue. Put that off until the next day after your procedure. Please let me know if you have any questions or concerns and how we can help to make you comfortable during your procedure today. Thanks.